Well, Benjamin Bouquet is a public health and human rights officer from the World Health Organization. He says Gaza's blockade by Israel has been one of the contributors to the health crisis.
Sure. So just to give you some context, WHO has released an emergency appeal this month, so calling for $2.1 million, and that's just to maintain life-saving and essential treatments delivered in Gaza. This, of course, comes on the back of long-term blockade, so that's been going on for 10 years now, as well as successive conflicts in the region, which have really damaged the health system of Gaza. So just to give you some figures there, in terms of the health system over the last, or since 2010, we've seen a decline in human resources per head of the population, so a decline in the number of doctors per head of the population and nurses. We've also seen a decline in beds per head of the population, so development just has not kept pace with population growth. And along with that, we've also seen decline in the health indicators. So, for example, infant mortality rate and the neonatal mortality rate have stagnated in Gaza where we would have expected them to improve. Also, breast cancer survival, we've seen an actual decline in that. So from 59% of people surviving 5 years in 2010 to less than 50% in 2016. I mean, for comparison, in Israel, the 5-year breast cancer survival rate is 80%. And Israel, as the occupying power, has a responsibility to the health of the Palestinian population, not just to promote, but also, not just to protect, but to promote that health. Beyond the health system, we're seeing increasing needs related to the underlying determinants of health as well. So, for instance, there's high levels of unemployment. Around a quarter of people in the Palestinian territory as a whole live in poverty and with food insecurity.